Hello, everyone, and welcome to the Hospital Marketing National podcast. I am your host, Patrick Bender, and on this podcast, we will be hearing from leaders in the hospital marketing space about what makes a great campaign, how you can define success, and where hospital marketing is headed. We have some great guests on this sixth edition of the Hospital Marketing National podcast, including Rob Rosenberg, the owner and president of Springboard Brand and Creative Strategy, Jason Pierret, the business development manager of the National Health and Wellness Division at ReachLocal, and Shelley Steele, the president at Corbin Design. To start things off, I had a chance to catch up with Rob Rosenberg over at Springboard. Let's see what Rob had to say. All right, I am joined by Rob Rosenberg, president of Springboard Brand and Creative Strategy. Rob, I appreciate you taking time out of your schedule to join us today.
Great. Thank you, Patrick. Nice to be here.
Rob has actually spoken at some of our conferences in the past. I know he's got a great grip on the industry and what's going on today. I guess just to start us off, Rob, do you mind just giving us a little rundown on what Springboard does?
Sure. So we are a really full-service branding communications firm that works primarily in the healthcare industry with hospitals, health systems, medical associations, and other health-related product and service type companies, and really focus on helping these organizations tell their brand story, develop their unique brand strategy, and determine the best methodologies to get them out there, whether it's communications or other internal and external engagement strategies, working with them on a pretty comprehensive basis all the way through to the implementation and measurement. So that's what we do. We help clients win in that regard.
Great. So you guys are working with hospitals around the country, correct?
We are, yes.
Awesome. So do you mind just kind of taking our listener through maybe an example of a time you guys have worked with a hospital into maybe revamping their creative and what you guys have done to help those hospitals better reach their consumers?
Well, sure. Lots of case studies, lots of examples. I'll actually use one that I just spoke at your conference in Atlanta. That was with North Mississippi Health Services, which is one of the largest rural hospital systems in the country, and they are essentially also a two-time Baldrige winner. One is a system, one is a large medical center. They have 6 community hospitals along with 1 tertiary hospital. So Marcia Tapscott, who's their director of communications and PR, and I spoke again at your Atlanta conference on this. And it was really a good case study on how to best position a health system in a market that even only a few years ago really didn't have as much knowledge and preference for hospital systems, more for individual hospitals. So in this case, a lot of research was done, focus groups were done and conducted to determine what people thought about health systems, how they viewed them, and what benefits they felt they derived from them. And what we learned is, in the case of North Mississippi Medical Centers, that the brand was very well known, but as we had suspected, it was only attached to the main hospital in Tupelo. And the goal then was to how do you extend the brand to reach out to the entire region and position it as more of a system than just an individual site. So the idea was to really showcase the whole notion of connected, and it's kind of a hot word these days in branding circles. It's a lot of banks and telecommunication companies, and in this case, hospital systems are talking about the value and the benefit of being connected. So what was fun about it is really from a creative standpoint, we thought of words and images that showed this notion of connectivity and what the benefits are, whether that's families holding hands and jumping off a pier together in a lake, or whether that's kids running and holding hands, whether it's hands that are holding instruments in the case of a medical setting, whether it's 2 fingers that are together. So it was a lot of fun to be able to do it, and it really differentiated the creative and made it very engaging for consumers to learn about connectivity in, I think, a pretty entertaining way.
Right. So I guess speaking on that, when you're working with a system, like that's larger, and there's multiple parts to the system, and you have to focus your budget on something or another, are you focusing your budget on something specific in order to maximize the effectiveness of the marketing, or are you just kind of spreading the budget out amongst all the systems or all the hospitals in the
Right,
system?
right. No,
Sorry.
great. Yep, great question. It's and it really does depend on the market, and it depends on the client, and the brand itself. In this case, and what I would recommend in most cases, if there's an organization that's looking to tell a brand story, branding is actually a very cost efficient way to go, because rather than you doing disparate campaigns and efforts for multiple service lines, which can add up, as you know, doing a more overarching brand program that might, as I like to call it, name drop different service lines to
Right.
support the brand promise, whether it's a service line or it's a specific user group or it's another site or whatever that might be, that it's an opportunity to bring them into the fold and really position the organization as one, so it raises awareness and hopefully preference for all the entities, while focusing on those that really do give support to the best brand story that that organization has. So branding, contrary maybe to a lot of listeners' own beliefs, is actually a pretty cost-efficient way to go. Even though the initial investment might be higher than a simple service line, it does, I think, bring some economies of scale to the effort and make it a little bit more efficient for the marketer.
Okay. Great. Great. So, in terms of some of those campaigns that you've worked and some of those case studies that you just described, what types of metrics are you using in order to define a successful ad or campaign? Is it
Yeah.
is something on the back end digitally, or are there more ways to measure a successful ad?
Yeah, again, it gets back to the objectives of the campaign, but we typically tend to kind of put them into three buckets, if you will, kind of start at the long term. And that's really where organizations, let's say, as in North Mississippi or any of the other larger health systems, want to measure brand awareness or brand preference. So that's really more of an attitudinal type of measure. And that's typically when quantitative surveys are conducted in their market. Maybe it's every 12 or 18 months, so that an organization can go back and say, our awareness, our preference, our usage levels are X, Y,
Okay.
and Z, and we have been able to move the needle on those by X percentage points. So that would be kind of the long term. In the short, in kind of the midterm range, you look at, let's say, more service line advertising. And whereas the latter I described would be more brand, let's say this mid-tier service line, cardiology, oncology, home care, orthopedics, whatever the case might be, and you run a campaign for that. So really, ultimately, it's about building volume and building, new patients into those either physician offices or other sites. So it takes about 6 months to be able to measure something like that. And
Okay.
there you really are looking at volume. You're really looking at usage and how many people essentially came into those offices, signed up for a program, had a procedure, and so forth. And that's why it takes about 6 months, because it's not going to happen overnight. You're not creating demand for those procedures, but you're being able to create hopefully usage in those organizations that are creating the marketing for it.
Okay.
And then in the short term, it very much comes down to primarily digital metrics, whereas on a daily, weekly, monthly, quarterly basis, organizations can track how their communications message is working, number of impressions, number of click-throughs, number of appointments made, all that sort of thing. And of course, clients are moving way fast into this direction. And
Right.
from an advertising, from a consultant agency standpoint, it's great because you're able to kind of review and adjust your messages very quickly in the digital space and kind of see how you're doing almost on a daily basis.
Great. Great. So let's talk about let's throw this scenario down on the table here. Let's say in 6 years from now, a hospital comes to Springboard and is like, Rob, we want you guys to work on on our brand. We want this or that to be revamped. Do you see yourself then doing anything differently than you're doing now? And where do you see hospital marketing shifting here in the next few years?
Well, it definitely will be. I'm sure it'll be done differently. It changes, pretty dramatically. I think every 5 years in the business. So, I think 5 years, 6 years down the road, you'll see predominantly a digital, mobile, application-based marketing strategies. Not that traditional big media won't still be a player, because I think even 10 years ago people predicted that now those media would be out of date, out of touch, but I think they're still very much in the picture. But it's just how they're being used, and I think as more marketers are pressured to provide results to their organization, again, as we discussed in how to measure, the digital arena brings, I think, much harder statistics and metrics on success of a campaign. So I think, and also in terms of being able to just look at where people are going now and how budgets are shifting, it's very much going to be a very, I don't even want to say digital because it is now, but it's going to be something different. It's going to be something that is much more engaging, much more living and breathing in terms of where we are 6 years from now, and where that's going to be. I have no clue.
Right.
Technology is changing so fast, but whatever that is, that's where we're going to be. It could be, in all the wearables and all the other things that are predicted to really boom. It could be that's where advertisers are best able to reach health-conscious consumers, on their watches, on their eyeglasses, in their car, on the reflective devices in their cars. It's going to be just a very personalized, very engaging, what I'll call very first-person type of reach.
Great. That's a great insight there. And great insight overall. I really appreciate you, Rob. Rob Rosenberg, president of Springboard Brand and Creative Strategy. Once again, Rob, really appreciate you joining us.
My pleasure.
Yeah. So you can check out Springboard and what they're doing at springboardbrand.com. Rob, is there anything else you want to add before we end?
No, great questions. We certainly appreciate keeping these kind of things top of mind and on the desktop and so forth of individuals who are listening. So I enjoy the opportunity to participate. Thanks for asking some great questions.
Awesome, Rob. But once again, thank you, and we'll be talking soon. All right.
Sounds great.
All right.
Okay, take care.
Next, I had a chance to speak with Jason Pierret. Let's see what he has going on over at ReachLocal. I'm joined by Jason Pierret, Business Development Manager of the National Healthcare Division from ReachLocal. Jason, I appreciate you taking time to join us today. Do you mind just sharing with the listeners what ReachLocal does and what kind of service you guys offer for hospital marketers?
Yeah, for sure, Patrick. ReachLocal is a total digital marketing solutions company. So, if it's under the umbrella of digital marketing, what you might think about with digital marketing, then it's something that, we handle. So it's everything from search engine marketing and pay-per-click strategies to social media advertising, to, more advanced targeting techniques like geofence display, which specifically targets mobile device. And then, certainly I think that you also can't leave out, the more organic pieces of digital marketing. So whether it's web presence or, social media presence and listings and reputation management, all of those things are things that ReachLocal does and that we specialize in. From a healthcare perspective, ReachLocal really helps the healthcare marketer reach the patient throughout the entire patient journey. So as they're considering where to go for their healthcare needs and really, trying to determine what makes the most sense for them, ReachLocal develops solutions and has solutions to put in place to reach that individual at all points of consideration.
Oh, great. And so you guys do a lot of work with hospitals on a national scope, right?
Yeah, absolutely. I don't want to leave out, the regional health systems or the critical access hospitals. I think we certainly, have different solutions for them as well. But I think really the focus that we have with national healthcare is in the fact that when you think about a hospital or a health system, they have a facility within a specific geography. So they're in a city, they're in a town, right? And so in the same way that, a local entity might need marketing that only reaches individuals within a certain radius of that facility, well, the national organization needs that as well, right? So sometimes decisions are made in a little bit different way, but at the end of the day, they really need to reach that local population who would actually utilize that facility.
Great, great. So a little background here for some of our listeners. Jason was actually a speaker on a digital panel back in June at our Hospital Marketing National Conference. You spoke on best ways to use digital to reach today's patients. You spoke a little bit at the beginning of our conversation here on digital and its role that it's playing right now in marketing. It's so big, and we're seeing such a shift to digital. Can you add to that a little bit and maybe give us a little example or a specific example of where you guys have used digital to help a hospital or healthcare system or critical access system to reach their patients? Sorry, that was kind of a long question there.
Yeah, no, not a problem. Yeah, I mean, I think the reason that we're seeing the growth in digital is because digital is allowing for hospitals and health systems to reach patients in new and innovative ways, right? And so the days of reaching a patient and having the most effective way to be in front of that patient be through traditional media or to have a billboard be the reason that a patient actually selects your facility are pretty much long gone, right? And so digital marketing allows for the hospital to reach the patient where the patient is, right? And so, I mean, there's a lot of things that we've done for hospitals and health systems. I would say that probably some of the most innovative things that we're doing for them is, we really work with hospitals and health systems a lot on patient acquisition. So obviously, if new patients are coming through the door, then that's a good thing.
Right.
And so one of the conversations we'll have with them is really, what's the front door to your health system? And it sounds like a simple question, but really it means, where is the place that patients are entering into your health system, and how do you keep them as a part of your system?
Right.
So, for some of these hospitals and health systems, it's the emergency department. For others, it's the urgent cares that they own. So at the end of the day, what we'll do is we'll tailor strategies, potentially, a combination of search engine marketing so we can make sure that they're found, and then including something more like advanced targeting to allow individuals within neighborhoods that surround that urgent care and places where there's a propensity to need urgent care. We'll set up campaigns that allow for us to target those individuals specifically, and then even show attribution of those individuals walking in the door of that urgent care, so that we're bringing patients to that hospital or health system the way that they need them to come in order for them to be able to filter them throughout the rest of the system.
Okay. So what type of metrics are you using to define some of those campaigns and or a successful ad for a hospital?
That's an interesting question, Patrick. And I think that, really every campaign is a little bit different, right?
Right.
So I think the question that you have to ask even in connection with that is like, what are the goals of the campaign? So like if the goal of the campaign is social engagement, then we're going to look at likes, and we're going to look at shares, and we're going to look at like post clicks, right?
Right.
But if in the example that I was talking about, we're talking about, patient acquisition, then basically we're including call listening, right? And we want to look at the map clicks to see, who was so interested in what they saw that they took the extra step to make sure that they could figure out where that facility is located, right? Or when we're talking about like the exclusive geofence and conversion zone solution that we offer, when that's in place, now we're talking about how many patients were exposed to the campaign and actually walked in the door of the facility, right? So there's a number
Right.
of different metrics that, depending on campaign goals, allow for us to really see how well something is performing.
Okay. All right. Well, I guess with that being said, you have larger healthcare systems, larger hospitals that tend to just bring in more patients regardless than some of these smaller rural hospitals. What are some things that some of these smaller, rural hospitals or healthcare systems, what are some things that they can do to retain some of their patients and to keep people walking through their doors?
Yeah, so I think one of the most important things that they can do is focus on the message that they're putting in front of their patients, right?
Okay.
So I think that, regional health systems and critical access hospitals, have a challenge in essence, branding themselves in the same way that the larger hospitals and health systems do. And I don't really think that, honestly, the critical access hospital has the same ability to brand themselves, and that's okay because they're not that larger hospital, right? So the reasons that they're important, right, and the things that they offer are different than the larger health systems. So I would say, first and foremost, right, focus on creative. So think like your audience. I think that it's important for, the hospital marketer to study up on them. So, are you looking at the social media pages of the individuals who are fans of your hospital on your social media, right? If you as a hospital marketer are not in the hospital, kind of auditing patients, so to speak. And I say that to say, like, are you having conversations with people who are actually utilizing your facility and trying to understand them and trying to see why they picked you and what's important, right? Then, at the end of the day, you don't really know how to effectively communicate to that audience. And I think the other thing is that nothing necessarily has to be set in stone, right? So I think one of the most important things that you can do is test it, right? Yeah. A/B testing is extremely underutilized in the marketing industry, but I think for hospital marketers, it's extremely important, right? So I'm not just talking about the color of a logo or a banner or something like that, but maybe taking half your audience and running a message about, some of the value proposition that you guys have as a facility, and then taking, the other half of the audience and trying something else to really kind of understand a little bit better as to how people want to engage with you and what really helps you guys to, connect with that audience.
Man, that's some great stuff. Jason, it sounds like you guys are doing some great work in the healthcare marketing side of this industry, and I really appreciate you again taking time to join us here on the podcast. Jason Pierret, Business Development Manager of the National Healthcare Division. Jason, we'll have to get you back on here again down the line.
Absolutely. We're excited to do it. I mean, I think that, quite honestly, Patrick, marketing is changing,
right,
like you had said, and things are really shifting towards digital. And so, the digital patient journey is almost everything nowadays, and it's really important for us to connect with patients in new and innovative ways. And I think, by the time 2030 rolls around, right, I think with some of the advancements that we're seeing in digital marketing nowadays, where, signage and billboards are changing based on the audience that they can see is actually about to be in front of that billboard or that signage, we're going to have to be more personal, more intentional, and more deliberate about the way that we market. And so I'm excited to continue to talk with you guys about some of the innovations that we have that will allow hospital market to do just that.
Man, that's some great stuff. Once again, Jason Pierret, ReachLocal. Jason, we'll talk soon, all right?
Good. Thanks for including me, Patrick.
Yeah. To wrap things up, I had a chance to speak with Shelley Steele over at Corbin Design. Let's see how she's making things much easier for patients when they go to hospitals. I'm here with Shelley Steele, president of Corbin Design. Shelley, appreciate you taking time out of your day to join us here on the Hospital Marketing National podcast.
Thanks, Patrick.
Awesome. Do you mind just telling our audience what Corbin Design does and where you guys are based and what you guys do?
Sure. Corbin Design is in Traverse City, Michigan, which is in the northern lower Michigan area, kind of a resort area, but where we spend our weekends because we're away on trips a lot of the time. We have been in business for 40 years, and we specialize in the institutional wayfinding niche. So hospitals, universities, and then downtown civic environments are our specialty areas there. So all very institutional based, obviously in a healthcare environment. The state of mind that the people are in as they're visiting is different than some of our other project types or any other type of wayfinding because they're generally not going there for a happy reason unless there's been a baby that's been born. So our goal is to develop something wayfinding system that simplifies a complex environment for that first-time or infrequent visitor and helps ease the stress. So it improves the patient satisfaction, the visitor satisfaction as they're either visiting or attending an appointment there at the hospital.
Great.
So that's our overall goal.
Great. Yeah, because I know just, visiting with different hospitals and hospital systems throughout the country, it can get stressful, confusing, making your way through a hospital. That's where you guys kind of come in and help out, correct?
Yes, we do the design and planning. So we start with a very comprehensive analysis process where we're looking at all the different wayfinding tools. How is the website directing the visitor? What are they getting from the referring physician? Any mobile apps that they may be using, any type of tool that's giving direction, we want to take a look at that and see if there's communication gaps, if there's inconsistency in terminology or confusing things that would make the wayfinding journey even more confusing than it already is in a large, complicated hospital setting.
Right. So,
and then our next step after that analysis is actually designing the exterior and interior sign type array. And then documentation is where we do location plans and message schedules. So we do the programming for where everything should go, and we prepare a bid package. So we're not fabricating and installing any signs. We're simply helping the client develop this plan. And then our fourth phase of work is implementation, where we would actually then help the client with the bid process and then consult during that whole fabrication and installation process.
Gotcha. Okay. So when you guys are working with these hospital systems and they're asking you guys to revamp, their wayfinding design, what does your team take into account when asked to do that sort of job? And are you guys working hand in hand with the hospital's marketing teams when doing so?
Yes, marketing and facilities are our primary direct contact. So we have a core team that is 2 to 4 people. So, sometimes there's 1 or 2 people from marketing. Sometimes there's only 1. There's facilities or administration. The other members, or sometimes there's only 2 members, and it's definitely those 2. But if there's a couple other members, then that's different for each hospital, depending on who's owning the project and why this project is developed. So sometimes it's a patient satisfaction or service excellence representative. It could be a lot of different, our nursing sometimes.
Gotcha.
You may have volunteer. And then there's a larger stakeholder group. So as we're learning about the facility and trying to learn about the different congestion areas, we do that during our first phase of work with them. And we're looking at, from the standpoint of as they enter the boundary of the campus, how easy is it to find parking?
Okay.
A lot of times we find out that parking's an issue. So if you can't get them parked in the right spot and in the right entrance, then that's really disconcerting for us because it adds more complexity to the exterior than should be needed.
Right.
So we're looking at those vehicular circulation plans, and then once we get them parked and in the correct entrance, then we're looking at the interior, pedestrian flow there, trying to keep them on wide hallways versus narrow hallways, making sure that we're giving them just the amount of information they need at each decision point and not too much, so we're not overloading them. We also want to make sure that we're using mapping elements, because as well as the terminology of the arrow, we're using universal symbols, we're using colors and different things because people comprehend different information differently. Some people want to look at a map and say, I'm here and I need to go there. Other people want to follow the arrow. Some people want to use a mobile app. Some people don't. So there's a lot of different supporting materials that are needed to designing systems.
With medical centers in over 80 cities in the country, across the country, do you find that people facility sometimes based on how easy or not to navigate throughout the system or hospital?
Sure. Obviously people tell stories about different locations. I do have in most cases, especially in populated areas, and there's a choice in where they so when you're setting that up, it's a visit, and there's obviously a lot of over hospitals, so we're seeing a lot of burn centers, so it's in most, and if they're more familiar with it or have had a good experience or heard about somebody that had a good experience there, they're going to be more likely to go to that hospital.
Right. Seeing in the future, how do you see finding changing here in the next few years, and how do you see it better marketing in the country?
Physical side of that, supporting materials, so whether it be digital or other technical means that will help reduce the number of signs that are in an environment. Hopefully, always going to need to be looking at how can this facility be decide what kind of zoning or districts or how can you break it up to make it easier, and then just get them to that area. And then once they're in that area, get that broke out. So you're always going to have to simplify that. There's always going to be a communication challenge there. There's always going to be terminology. There's going to be the need for staff education.
Right.
So there's still always going to be needed to give information. But I think as these technologies get better, as processes get better, hopefully we can actually reduce the number of signs in an environment.
Okay. Interesting. Well, this is all great stuff, Shelley. I really appreciate you once again, taking time out of your day to join us here in the podcast. I think wayfinding is very important in terms of, people choosing their right hospital and where they live. So I appreciate you coming on. I think you guys are the first, wayfinding company to join the podcast. So once again, I appreciate you joining us, and I hope we can talk down the line.
Great. Thanks, Patrick. Thanks for your time.
Awesome. Thank you. That wraps up the 6th edition of the Hospital Marketing National podcast. I'd like to thank Rob, Jason, and Shelley for their thoughts and their time. We love your input on great hospital marketing as well. Please email me to participate in our show with your thoughts at patrick@dtcperspectives.com. And please don't forget about our great event, the Hospital Marketing National Conference, which takes place here in Atlanta, June 5th through the 6th of 2018. We'll have great speakers like these presenting their approaches to marketing, what works and what doesn't, case studies, market research, plus awards for some of the best hospital marketing campaigns and hospital marketers in the industry. You can get more information on that at www.hmnconference.com. For all of us here at DTC Perspectives, thanks for listening to the Hospital Marketing National podcast. I'm Patrick Bender, and I'm looking forward to having you listen to our next show with more great speakers and great content. Thanks, and have a great rest of your day.